Hello, everyone. I'm a research associate in the Department of Orthopedics at BC Children's Hospital. Today, I'm going to talk about the work I did as part of my PhD thesis, which I finished in 2021. So this presentation talks about measuring what matters to children with lower limb differences, which was used to develop a new patient-reported outcome measure for this patient population. So first of all, what are lower limb differences? These are conditions such as leg length discrepancy, where there is one leg shorter than the other in length, or there is complete or partial absence of one or more segments of the lower limb. So as you can see on the screen, on the left-hand side, there's a child, and there's an image of a child with a leg length discrepancy, followed by an image with angular deformities of the knee. And on the far right is an image of a patient with an amputation due to a lower limb difference. The treatment and management of lower limb differences is quite complex and long. The type of treatment usually depends on the type of the lower limb difference itself, the stage of the condition at the time of presentation, and the skills of the treating clinicians at the treating hospitals, and also the place where you live in and what kind of resources are available. The non-surgical treatment options for these children usually involve the use of shoe raises and shoe lifts, as you can see in this image, and specialized splints which optimize the function and mobility for these children. The surgical treatment options, on the other hand, are also quite complex and long. They can range from limb lengthening and reconstruction procedures on one hand to amputation on the other hand. The first two images from the left side show a lengthening procedure being done on a patient. There's a huge metallic device that stays on these patients for up to 9 months. On the right-hand side, there's a child who had bilateral amputations done right after their birth due to their congenital lower length difference condition. So both of these treatment options, they come with their inherent risks and complications, which can impact the child and their families in many different ways. So apart from these complex treatment procedures, you can imagine these children have physical challenges which impact their physical participation in the day-to-day activities of life, and also in sports and recreational activities, which are quite important for children. Their physical limitations also impact their social participation at different levels, their participation in activities at school and outside of school as well. And because of these physical and social limitations, these children often remain at a high risk of emotional and behavioral problems in their life, which can impact their overall health-related quality of life. So that means it is really important for us to measure how these lower limb differences impact the health-related quality of life, and more important, to really understand it directly from a child's perspective and to really find out what matters most to these patients. With this knowledge of the impact and the importance of measuring their health-related quality of life, we really wanted to know what is it out there in the literature that we can use to measure their health-related quality of life, and specifically using a patient-reported outcome measure. We conducted a systematic review with this aim in mind to identify what is out there in the literature. Our systematic review showed us that the 10 studies in our systematic review had used 24 different outcome measures for this one patient population. And out of those 24, there were only 2 questionnaires. Those were specific to lower limb differences. But both of those questionnaires, they were either not designed specifically to be used in children, or there was no input received from children in the development of these questionnaires. There were also generic questionnaires like PSQL, short form 36, that were used in this patient population. Another questionnaire, which was recently used in a publication in 2019, was the limb lengthening satisfaction questionnaire, which is an adaptation from another questionnaire. And again, there was no input received from children to develop this patient-reported outcome measure. Hence, our systematic review really confirmed the lack of a patient-reported outcome measure for this patient population. The systematic review also helped us develop a preliminary conceptual framework of themes which have been studied for these patients in the past literature. And these themes included physical health, psychological health, and social health. And there were a number of sub-themes under each of these sub-themes that we were able to pull out from our systematic review. With this knowledge in mind, and the confirmation that there is really a lack of patient-reported outcome measure for these patients, we started looking at the process of developing a new patient-reported outcome measure. We looked at international guidelines for the development of PROMs from WHO, FDA, ISPOR, and International Society of Quality of Life Research. And all of these guidelines listed 3 main phases in the development of a new PROM. Phase 1, broadly called as the item generation phase, which is further broken down into multiple steps, starting with a systematic review, followed by a qualitative study, and then a content validation study. Phase 2 is broadly called as the item reduction phase, and phase 3 is the psychometric testing of the new questionnaire. Since we had already done the systematic review, our next step was to conduct the qualitative study. We conducted an international qualitative study with the aim to identify the concepts that are most important to these children. We really wanted to understand what is it that matters most to these children. And this study was published in the Journal of Patient-Reported Outcome Measures. We conducted qualitative interviews at 2 sites in Canada and 1 site each in United States, Ethiopia, and India. We conducted face-to-face semi-structured interviews with children with lower limb differences between the ages of 8 to 18 years. And we also did separate interviews with the parents. For these interviews, our aim was to have a heterogeneous sample of patients from different countries so that we have children that differ by the type of deformity itself, the type of treatment, their stage of treatment, their gender, and their country of residence. And a multi-center approach was really helpful for us to ensure that heterogeneity in our sample. We conducted 79 interviews in 4 different countries, 5 different sites, and in 5 different languages. And based on the qualitative analysis, we were able to develop a conceptual framework of concepts that were really important to these children based on these interviews. This included themes like appearance, physical health, psychological health, school, and social health. And under each of these themes, we were also able to list sub-themes that were important to these children as we found from these interviews. For example, under appearance, these children talked about the concerns they had about the appearance of their body parts, the appearance of their limbs with the scars, and appearance of certain clothes they could wear or they couldn't wear because of their limb differences, their shoes, and assistive devices they had to wear. In the similar way, we had psychological health, which had sub-themes like the concerns around their body image, the psychological distress these children had, and their issues with confidence and self-esteem. So using this conceptual framework, we started the next phase in the development of this questionnaire, which was generating the items and forming the scales for the new PROM. So for example, under appearance, we wrote an exhaustive list of items under each of the sub-themes, and those items then formed the appearance scale. For physical health, we wrote an exhaustive list of items based on what we learned from the interviews, and those items formed the physical function scale. For symptoms, we wrote a list of symptoms for each part of the leg, and those items formed the individual symptom scales for those parts of the leg. A similar process was used to write items and form scales for other themes. Item writing and scale development is a creative synthesis of knowledge. And for us, the biggest source of knowledge was qualitative interviews with the children and really understanding what is it that matters most to these children and ensuring that those important concepts are incorporated in building the items. We also did consultation with PROM development experts, clinical experts, and we looked at the guidelines from the literature. We took special considerations around the length of the items, wording of the items, ensuring that the reading level is lowest possible. For us, we picked up a reading level at or below a grade 3 reading level for our patient population of 8 to 18 years and a shorter recall period of 1 week. Here's an example how we used the quotes from the interviews to generate the items. So this is an example of some quotes under the appearance scale. And on the left-hand side, you can see how we wrote items under the appearance scale based on those patient quotes. The next step in the process of development was content validation, which is the empiric evidence that demonstrate the items and scales of an instrument are appropriate and comprehensive relative to its intended measurement concept, population, and use. The three key concepts that we looked at was comprehension, whether the items are easily understandable by these children with lower limb differences. Are the scales comprehensive enough? Are they covering the entire range of construct that we're measuring? And are these items relevant to these patients? Are they able to relate these items included in the prompt to their own experiences of having a lower limb difference? We conducted cognitive debriefing interviews and expert input interviews with a wide range of clinicians from sites in Canada, USA, UK, India, Ethiopia, and Australia. In total, we conducted 40 interviews. The cognitive debriefing interviews and expert input interviews were done face-to-face, and we considered children as content validity experts, and semi-structured interview methodology was used. Children were asked to read out loud the items and scales, and then tell us what they understand from those items and instructions, and tell us if there's anything that is relevant to these children that we have missed. These interviews were conducted in rounds to ensure that we make edits based on interviews in each round and then use the edited version for subsequent rounds. In total, we did 5 rounds of interviews. And by the time we were at fifth round of interviews, we had 11 scales and 158 items. And most of the items from the interviews were added around the symptom scales. The children during the content validation interviews seemed to understand most of the items really well, but there were little tweaks that were made to some items as seen on the screen. The children also found that the items were quite relevant to their experiences. Similarly, the clinical experts also found the items to be quite comprehensive for this patient group, and they were very inclined to use the new questionnaire in their patient population. So at present, we have finished phase 1 in the development of this new patient-border outcome measure, and we are currently conducting translation and cross-cultural adaptation for the sites where English is not the first language. And we're working with sites from Finland, Denmark, Germany, India, Kenya, Uganda to do the translation and cultural adaptation, and with the English-speaking sites across the world to obtain necessary approvals for an international field test. So once this questionnaire is developed, it will be the first patient-border outcome measure that can actually measure what matters most to these children, and it will be applicable internationally. And healthcare professionals will be able to use this questionnaire to look at the effectiveness of various treatment options in terms of improving the overall quality of life for these children. Thank you.